right now you guys are gonna keep jogging.
This is one way to get off to a strong start.
We're gonna take advantage of the space, and we're gonna do some explosive running drills, we're gonna do some sprinting.
For the first time in 10 months, this fitness trainer gets to see his students in action in person.
So to do this like this again, like I'm so excited.
But the small outdoor class is more than just a workout.
It's kind of like the light at the end of the tunnel almost.
As online fitness classes take a back seat, so can online shopping. Non-essential retail shops with street access can open at 15% capacity. Those stores inside malls are still closed.
I feel like I'm going to start spending a lot more money.
This retailer says reopening with new restrictions each time is a challenge, but
we need it to be open. We can't, we've only been open 6 or 7 weeks this year.
For many, the first taste of normal life is on a restaurant patio.
Feels like freedom. It feels great. Cheers. Cheers.
And it's a chance to get back to work.
We have about 35 staff, and we've had to lay off about 15 of them, and they're all coming back as of this weekend.
Though there's a long way to go and COVID-19 is still a threat. There are several hotspots in Ontario for the Delta variant, the one that hit India hard. In northern Ontario's Porcupine region, there's concern over rising cases, so it's not reopening. Even elsewhere, some are worried this reopening will lead to more people getting sick.
And then they'll just panic again and shut things down.
The owner of this Ottawa restaurant hopes that doesn't happen.
We're keeping our fingers crossed. If we have to close again, that would be a really difficult blow.
So, Jacqueline, there's another patio behind you on Toronto's waterfront. How hopeful are people there that this is going to last?
Well, the ones we've spoken with are optimistic that the data shows that this time it's different than it was the last time restrictions were lifted. But I can imagine there are some people at home tonight who are waiting this out, perhaps waiting for that second dose. And if all goes to plan around vaccinations and caseloads, Ontarians could do even more in just 3 weeks. And Ian, that means we could finally get haircuts.
Thanks, Jacqueline. Let's bring in Dr. Susy Hota, an infectious disease specialist with the University Health Network in Toronto. Dr. Hota, exciting times as various provinces start to reopen, but what cautions should we keep in mind?
The first thing is we need to go slowly, and we really need to watch the numbers, because we know that the Delta variant is about 60% more transmissible than our current variant. So the numbers can take off if we're not on top of things. And the other thing is we absolutely have to keep on top of continuing with our vaccination efforts. Both first and second doses are critical at this point.
So there's a story from Calgary about an outbreak of the Delta variant in a hospital, and that some of the people had both of their vaccines. Not a lot of details, though. What are some of the things you'd like to know about that?
Well, first of all, I don't want people to panic hearing that, because we know that outbreaks are not usual circumstances. There can be higher exposure degrees and other drivers that we don't know about yet. But I'm very interested in knowing the details around these cases. So in those who are fully vaccinated who got infected, when did they complete their vaccination series? Was it recently, so they didn't have enough time to build up immunity, or a really long time ago and maybe that immunity waned? But also, how sick were they? Well, during outbreaks, we do a lot of asymptomatic testing, and so we may pick up these asymptomatic cases or minimally symptomatic cases, which are less concerning if that's a case of breakthrough with the Delta variant and vaccination.
This has been your message throughout the pandemic. Don't panic, but be cautious. Dr. Hota, thank you.
Thank you.